Hello, everyone. Welcome to the interview series, Sharing Our Stories. I'm Dr. Shiva Rathbun from the Connecticut Psychological Association. Our goal for the series is to create a deeper connection between psychologists and our community. And today, I'm so excited that we have Dr. Elizabeth Rathbun with us. She has been a CPA member for 21 years and has served in different leadership positions for so many years. She's a licensed psychologist and a certified eating disorder specialist. She currently serves as the APA Council representative for the CPA and the CPA board voting member. A warm welcome.
Thank you so much, Shiva. I'm so happy to be here today.
Wonderful. So I'm going to start with my first question. Would you please tell us briefly about yourself?
Absolutely. Well, I am originally from Massachusetts, and I navigated to Connecticut through graduate school and then internships and eventually postdoc, and ended up staying around. And I began kind of my doctoral graduate program and career trajectory really in Connecticut. My internship was at the Greater Hartford Consortium, where I did it was a multiple kind of placement internship at the Newington VA. And worked in various parts of that, the integrated care clinic, the substance abuse unit, as well as working with a range of clients with PTSD. And then I also worked at the Emily J. Yukon Child Trauma Clinic, where I worked mainly with youth at a range of ages who had various trauma histories. I focused mostly on CBT and trauma-focused CBT at that point. And then I kind of expanded. I went to Yale to do my postdoc and stayed there for a while, working on research and clinical studies in addiction, disordered eating, and a range of chronic stress-related issues. And in 2015, the clinical portion of Yale Stress Center closed, and so it was an opportunity for me to start my own private practice. It's something that I never had thought that I necessarily wanted to do, but it was kind of like, why not? So I've been doing that now. So I'm in my 10th year, and it's been amazing, the flexibility and just to be able to kind of create my own business and my own practice and really form it around the clients that I want to serve and specific populations. I mainly work with clients with a range of disordered eating disorders. Generally, there's some level of trauma, anxiety, depression. I work with adolescents as well as adults, and I do a lot of individual work as well as group work, some consultation. I teach some classes, some intuitive eating classes, as well as mindfulness meditation. And I just recently got certified in internal family systems, and I'm finishing my certification in EMDR currently, and those have also really boosted my practice, and I've seen my clients making amazing gains from those particular therapeutic interventions.
Such an adventurous journey you have had. And congratulations on your business. And the most important part that you said you never expected to have your own business.
I didn't. It was not something I planned. And there's parts of it that I don't love. I feel a little bit isolated in private practice, but that's why we have, different networks and a lot of Zoom peer consultation meetings. But it was really, I feel like such empowerment from doing it. I never thought I'd be a business owner, in my own business. And so there's parts of it that are so exciting. And I feel like, I've done something that I never expected and maybe never thought I could do. So
Beautiful. Um, and tell me, what prompted you to become a psychologist?
this is such an interesting question. And I really do feel like I know it's not necessarily common, but I really knew when I was young that I wanted to do this. I grew up in a very small town in the Berkshires called Stockbridge, Massachusetts. And this is the Norman Rockwell town, literally. And there was a very famous, well-renowned, world-renowned psychiatric hospital there called Austin Riggs Center. And what's different about this hospital, it's an inpatient hospital. However, people are not on locked units. So people were, there getting treatment and also part of the town. And my dad, who actually passed in 2018, was a very friendly, kind of the town friendly guy. And so he often met people who were getting treatment there. And oftentimes, because they often were away from family, they would spend holidays with us, some people from there. And I think it opened my eyes to, humans are humans. And I also think I have a natural curiosity to kind of understand people. But there was just something about this experience as a kid that was like intriguing, but also like very hopeful. And I was always drawn in. Whenever there was kind of a crisis or problem, I was kind of someone who was wanted to be helpful. And I think I'm pretty good in emergency situations. And so I think for a lot of reasons, I was drawn to this profession. And I'm just like I said before, very naturally curious. And I think my family is very compassionate. And so I think I was able to continue that trait, which I feel very fortunate about.
So no surprise that you are also so compassionate.
Thank you.
So, how has the CPA shaped your professional journey?
Yeah, I mean, I think what's been amazing for me is that I've been a member since I was a graduate student. And I was introduced to it in graduate school. I mean, I always kind of knew that there was psychological associations or like a guild, professional guild for professionals of for certain fields, but I didn't really understand what they did. And so I think being exposed to this in graduate school and learning about, wow, there's this association that is really a place where, people in the field can feel connected and also build advocacy and really legislate and help with legislation for important mental health efforts and get involved in different levels, like a, kind of a grassroots level, as well as, CPA introduced me to APEG. So I was also an APEG's representative for the Northeast for a few years in graduate school. So I feel like it was an entryway into so many aspects of psychology. I was kind of doing the practice part and the clinical part in learning and training in school, but this was this other area that was so intriguing, that was about advocacy and was about policy and was about, how do these laws change and how do we get more support for people who really need it in mental health, and how do we also help shape our careers, our future, our profession, and support each other and network. So it gave me kind of all these other things that I don't necessarily feel like graduate school, although I had a wonderful experience, necessarily gives you and teaches you in terms of like these other aspects. So it offered so much. And then the mentorship, which to me was amazing, being able to see these people who are in different areas in the field, research, their own practice, different agencies, consulting, all over, really, kind of academia as well as clinical practice and more consulting, and then having them come together, at board meetings and events, and so it was like this parallel process, like, there was teaching, there was in some ways mentorship and supervision, but also being able to see the variety of ways that I could eventually go in my career. And just having these more seasoned people supporting me, I felt like that was such a foundation for me. It opened up so much.
Beautiful. And are there particular CPA leaders who have inspired you along the way?
Absolutely. I would say um, one of the key people in my journey has been Dr. John Meem, who was my advisor at University of Hartford, where I went to graduate school. And he also kind of brought me into advocacy. I served as the student advocate on the board. This is where I was able to help and support lobbying efforts that CPA was doing at the Capitol. This is where I kind of learned more about the association CPA and what it does, and membership, and just different ways CPA is connected and all the advocacy they do. And he also served on my dissertation and just helped me so much along the way. And it was amazing to follow kind of his career. He's since retired in California with his family now, which is amazing. But he was a big inspiration for me, as well as Jan Owens Lane. She founded EDTF on the board, and she was always this amazing, empowering woman of color that just taught me so much, and just was constantly supportive and checking in with me, and offering this and mentoring me in different ways, and just be able to see what she's done has been amazing. So I feel like there's so many, it's hard to mention everyone, but Steve Moore was also one of those people who was always rooting for me and checking in and seeing how he could be of assistance. Mickey Lasher is another person who was amazingly supportive. Chris Ringling, who's moved since to Chicago, but there's a number of people. Ann Klee, who also has helped me understand more about APA leadership and CPA and how those connect, and just in general more legislation and political parts of APA and how policy runs and all those kinds of things. So I feel like I can't mention everyone, but so many people.
Excellent. Such beautiful that you share all the people that help you along the way. So our success is the combination of whoever helped us through our journey.
Totally.
So Beth, congratulations on all you have achieved, and you're doing all the service for our community. We appreciate that. Is there anything else you may want to say at the end?
I would just, like to say, if anyone is on the fence about joining, or, doesn't really see the value in becoming a member, I think it's one of those things where we can show it on paper and we can talk about it, but it's more the experience, and the more that you get involved and really see the inner workings of CPA, I think it's almost like a bug. Like, I felt like I got kind of an advocacy bug when I joined CPA, and like there's so many parts, there's so much inner workings that I don't think necessarily we see from the outside, and it's not on paper. But when you get involved and you get to know people and see what they're doing, and you're part of the advocacy efforts, it's like you realize, wow, there's so much going on in our field. There's so much I can be a part of that we might not see on the outside, how much CPA does, and how much we can actually affect change in the mental health and psychology field. So.
Exactly. And so many times I have experienced your support for the social justice. Out of the blue, Beth has a new idea for us. So we are really thankful for that. And I want to say thank you for accepting our invitation and for helping create these powerful, inspiring moments together.
Thank you. I'm so grateful.
Thank you. And also, I want to say thank you to our dear audience. Thank you for watching this video, and let's continue a future rooted in purpose and possibility. Thanks, everyone, and bye-bye.